our subscribers. Today in this video we'll look at the scopes that we'll be getting in pharmacy practice. Bala and Sagar will be briefing you about the scopes and about some placement that we can opt after pharmacy practice.
If you see in the scopes, there are a lot of scopes for the pharmacy practice department. You can go into HUR related jobs, like HUR is Health Economics and Outcome Research, in which we deal with articles where the articles describe about multiple clinical trials which are happening all over the world, and we have to come up with a single pooled evidence in those all articles and create evidence for a drug whether it works in all the different population settings. And along with this evidence, we have to add on the pharmacoeconomic models such as cost benefit analysis and cost minimization analysis, in which we check among all the drugs available for a particular disease in the market, which drug is both efficacious and also cost effective, so that we can also include the patients who are on low economic state. So this is what we basically do in the HUR job setting. And then the other scopes are there, such as clinical research scopes, in which we have to deal with the clinical trial which takes place. There are openings like clinical research associate, clinical research coordinator and such, where you will deal with the procedures and protocols of this clinical research and clinical trials, where you have to take care of the patients getting enrolled in the clinical research and so on. And now I will hand over to Sagar.
So I'll try to segregate the job opportunities in two simple domains. One is the government domain and another is the private domain. In general, you can correlate the pharmacy practice course with the clinical pharmacist, that is clinical pharmacist post in the government domain. And some of our seniors are also there in a good position in the Kerala government. So moving towards the private sector, the pharmacy practice department is mostly related to the public health domain, and there are various domains across, such as those stated by my friend Balaganesh regarding the health economics outcomes research, clinical research, and adding to these domains there are some other domains such as pharmacovigilance and clinical data management. So you need to get updated about the different diseases and the updates of the different guidelines also in the pharmacy practice domain, and how pharmacy practice is related to all these domains. And what you learn actually in this course is that, for example, if you take an example of the clinical research which he stated, you will come across the ethical clearance about preparing the informed consent forms which are related to that particular domain. And when it comes to pharmacovigilance, we deal with the individual case safety reports, how to write a case safety narrative, how to process those cases. So these will deal you more with the drug safety associate jobs in the pharmacovigilance domain. And regarding the clinical data management, it all deals with the data management process, all the clinical data management processes. And apart from this, you have another domain, that is business analysis and development. You can also excel your career in this particular domain. So there is a wide range of career opportunities, and also there are some hidden perks of opting this department. Adding to it is, in other departments you may see subjects like 7 to 10 subjects, but in pharmacy practice domain there are only 5 subjects which you can explore, and you need to be thorough with the pharmacovigilance and the therapeutics part. So it is easy to deal. You will get much time to upscale yourself in with different skills also. That is one of the added advantage in this pharmacy practice domain.
And I would also like to add up, there is not only scope in jobs itself. You can, if you are interested further, you can also opt to do a PhD in this pharmacy practice, where you will learn more deep into the sectors like SLRMA and the hospital setting clinical research. So when you opt to do PhD in this pharmacy practice, there's a lot of scopes waiting for you in abroad.
Just like health economic modeling, remodeling, these are the new concepts that are coming up in pharmacy practice domain, that all you also can explore. And mostly if you want to go to the foreign settings, pharmacy practice is a domain of choice for you. So yes, that's a wide range of opportunity. Thank you and good luck.
After both of them has briefed you about the scopes, And I would like to tell you that always choose course over college and have a clarity in your mind for which domain you are going. And all the best for your NIPER counseling. Hope you land on a good college in a good branch.